Botox for depression? In short, yes, maybe. Glabellar Botox, Botox between the eyebrows, the scalp muscles, has been hypothesized to disrupt proprioceptive feedback, facial sensations that reinforces negative emotions which may help with depression. You don't feel your scaling, so you're less depressed, I suppose. But there is more to it than that. Post-marketing surveillance of Botox data showed that patients who received Botox injections to treat hyperhidrosis, underarm sweating, facial wrinkles, migraine prophylaxis, spasticity, and spasms had a significantly lower number of depression reports when compared to patients undergoing different treatments for the same conditions. These findings suggest that the antidepressive effect of Botox is significant and surprisingly observed over a broad range of injection sites. Interestingly, the antidepressive effect of Botox did not depend on the injection site, which means the whole facial proprioceptive disruption theory isn't the whole story. There are some theories, but nobody knows for sure why Botox improves depression. The interesting thing is that the doses used for upper and lower limb spasticity are huge compared to the minute amount used in blepharospasms. Most of the evidence on the antidepressant effect of Botox comes from studies of glabellar injections, the scalar 11 lines, and in migraine treatment. In fact, there are upcoming phase 3 trials looking at Botox as a treatment for depression. So, we need new treatments for depression. There are 300 million people worldwide who suffer the physical and mental pain of depression. According to the World Health Organization, depression is the leading cause of disability worldwide. And because a large proportion of people do not respond completely to our current therapies, millions of people suffer chronic depression. In other words, we need something that works better than our current therapies. Recently, a review article which covered the past 2 decades showed that even though serotonin reuptake inhibitors like Prozac and Lexapro improve the symptoms of depression for millions of people, they also increase the risk of suicide, and surprisingly, the article also showed that the whole idea of a chemical imbalance of serotonin in the brain that causes depression is wrong. I'm not saying we should throw away all antidepressants, but we need to get off the idea that we have depression all figured out, and we don't need anything better to treat it, because we do. Also, as an internist, I would never propose a magic bullet. Depression can also be caused by things that Botox can't address, like life events, hypothyroidism, low testosterone or growth hormone levels, malnutrition, postpartum hormone changes, elevated prolactin from pituitary microadenomas, and much, much more. So Botox is not a magic bullet to cure all depression, but multiple papers and strong evidence do suggest that Botox can be used for depression as part of a multifactorial approach in some people. My request to you, if you think you would like to try Botox to help with your depression, please do not stop taking any of your antidepressants. You can take your antidepressants and still use Botox to help them work better. Or if you suffer a milder depression or anxiety and you're not on medications and not contemplating suicide, and want to see if Botox might help you feel better, then that's all good too. In either case, call Rejune MD at 262-373-0169 to schedule your no-obligation Botox evaluation. Okay, so here's Darwin's contribution to psychiatry. Darwin's actual contribution to psychiatric learning appears not in Origins of Species, but in his often overlooked work, The Expression of the Emotions in Man and Animals, published in 1872. There he described what subsequently was called omega melancholicum, or the omega sign, a facial expression involving a wrinkling of the skin above the nose and between the eyebrows that resembled the Greek letter omega. It seemed to be diagnostic of melancholic illness at the time, or depression. Thanks for watching.